I'm coming up on 10 years of nursing, so I want to give you a little insight of all the different jobs that I've had. So if you're a new grad or if you've been a nurse for a little while, you can see the different specialties that I've been in. Maybe that'll influence you to go somewhere, maybe that you haven't thought about, but it might be a multi-part series only because I've done so many different things and I want to give you insights into each job that I've had as well, if there's been a little something that's gone on. But my first job was, I got hired right on the spot. I believe I applied and interviewed, and right in May of 2016 I got hired day shift, which was unheard of for a nurse, especially a new nurse, to get a day shift position. And I was like, hell yeah, day shift. But it was on a very busy neurotele adult unit. And now at this hospital, it's in a level 1 trauma center, so those patients were very high acuity. And I can't remember, I think we had 4 or 5 patients per one nurse. But obviously, the older population, very sick, and just very, they needed a lot because it's in a very underserved community too. So those patients may not have had health care otherwise besides going to the hospital. Now, was this the job that I wanted? Maybe not, but again, back then, jobs are hard to come by, and especially, like I said, day shift positions hard to come by. So of course I'm going to take it. And then I just remember having a patient who would take their stool and put it on their lunch tray, and it was just very, I didn't want to work there for a long time. So as I was working there, I was still applying to other jobs. I did end up getting hired in an IC unit, which by itself is a different story that we can get into. And then ended up staying at this neurotele unit after that as a breaker nurse. So I would come in at like 3-4 hours in the middle of the night and just do all the breaks, which felt better for me because I didn't want to take care of those patients just for the entire 12 hours. So doing it for those 30 minutes at a time while nurses were taking their breaks was perfect for me. And now in nursing school, I always thought that I was going to love neurology, the brain, everything about it, learning about the shifting of the brain when there's brain injuries, like all this stuff, in doing the NIHSS, see, I don't even remember what it's called, but for the stroke scale. That's where I thought I would always want to be, besides like the heart. I want to do brain, not heart. But I didn't last there long. I lasted there for 3 or 4 months. Now part 2 will be the one where I got the ICU job and what happened while I was doing orientation there.